Good afternoon, everyone. It's Dr. Scherer here. As you can see, my self-protection is increasing. Happy St. Patrick's Day. This is a very different St. Patrick's Day than most, but I did wear some green, right? Today, parents are probably appreciating their teachers a little bit more in the state of Illinois. I'm coming to you today to share with you information that might help inform, alleviate stress, and assure you that we are a great nation that will rise up and achieve great medical success in this crazy time. I want to do a correction from yesterday. There were 10,000 ventilators stockpiled and 62,000 ventilators in the nation. My thoughts for today. I wonder if you, like me, are a little scared, a little stressed, fearful and anxious because you either worry about not having an income currently, or worried about is there going to be food at the grocery store, or will I have a retirement, or what happens if I get COVID and I die? Getting stressed, fearful, worried, anxious are all beautiful emotions because something positive can come out of them. For one, when you feel these, you might hug your kids a little bit more and pay attention to their smile. Most of us have probably called up an old friend just to chat because we're bored at home. Or maybe we've heeded the medical provider's warning and we've stayed home. These emotions can keep us safe and they can connect us. They're not bad emotions. The thoughts behind these emotions are where the problem is. What if I don't have any income? We might worry about that. And I ask your neighbors for help. They're there. The good people around you have food, and some of them even have monetary donations that they're willing to give you if you need help. You don't need to worry about that. Just ask. You wonder, what about my retirement? The rest of us that invest are all in the same boat. This has happened in the past. The economy has turned around, and we've had stellar growth as a nation. Similarly, if you can't draw from your retirement right now, ask your neighbors for help. They will give you food. They will pitch in. They will go grocery shopping for you because you're not supposed to leave the house if you're retired, because you're probably of the age of 65 and older. If you're worried that there won't be food in the grocery store, there's been no indication that our supply lines for our food are going to be affected. And if you need to, come look in my deep freezer down in the basement and pick what you need from 3 years ago. So now the question I really want to address today is, what happens if I get COVID? And am I going to die? This seems really scary. So let me help with that. Why is this virus so scary? Why is it getting so much attention? Well, it's because this particular form of the coronavirus is new to us. Researchers and medical professionals are learning the characteristics on the fly. But the good news is that there are other scientists around the world who are becoming very quick experts to help us. The virus is unusual. It appears to spread quite quickly. It does have the ability to spread from people without symptoms. It's making a small percentage of people really sick really fast, but it's a higher number than other viruses. And we don't have any natural immunity to it at this point. We haven't had it in our environment before, and we don't have a vaccine for it. So why isn't this scary? Why should you be comforted? Well, you're surrounded by an amazing medical community. In fact, one of the top in the entire world. The physicians and nurses taking care of you are willing to put themselves in harm's way and pick up this virus so that they can help you when it's your time of need. The doctors and nurses will be there no matter what. You are getting care from the most amazing minds in the world. We have a remarkably good education system for doctors where we educate the top 10% of the nation in terms of intelligence. We have collaboration through new technology where doctors in other countries where this is already bigger than it is here are sharing information. We have the equipment we need to keep you alive. And for the most part, even if you get really sick with a COVID infection, there's still a really good chance you're going to survive. What do I as a provider need you to know? We are anxiously awaiting massive testing in the community for COVID. If you look at the statistics, Illinois has over 12 million people living in this state. And according to the Illinois Public Health Department's website, we've tested 1,200 out of 12 million. The testing needed to contain this might be too late. But what is important is that when you are sick, we will take care of you. The plan for my clinic, if you're in the neighborhood, you'll see an outside station set up, is to do telemedicine visits. Screen you first, and then if you need to be seen, is to see you out in that tent in my parking lot. I will check your oxygen level, your temperature, and I will listen to your lungs. And if you have a mild case, maybe on telemedicine, I decide you don't even need to be seen at this time. But if you do need to be seen and your symptoms are mild and you have enough oxygen in your lungs, you'll get sent home. And I'll give you specific instructions to stay in your house, quarantine yourself, and the things you need to watch out for that might arise in the next week that would cause you to have to seek care again. If you were having trouble breathing, your oxygen level was low, or I had other concerning signs that you might have a serious COVID infection, I would send you to the appropriate place to be treated. If we look at the World Health Organization data from China, 80% will have mild disease. Fever, cough, aches, and pains. Some of us will have moderate disease, temperatures up to 100.4, coughing, can't get out of bed, shortness of breath, that's very mild for maybe 2 weeks or so. These people should get checked on an outpatient basis. They don't need to be in the hospital. So that means that there are about 14% of people who will have severe disease and will need to be hospitalized. What that means is that 86% of people don't need to rush to the hospital. 14% are those that are going to need to go. These are the ones that can't catch their breath. They have chest pain and pressure. If you can't wake someone up who's got it, or if you notice that they have blue lips, they probably need to go to the emergency room. They will also have fever and coughing. Of that, 4% will be super sick, and these are the people that will wind up on ventilators. The immune system has tried to come and fight the infection, but it damages more lung tissue and fills the lungs with fluid. And these people cannot breathe. However, if we can sustain them long enough on a ventilator, most will recover. The good news is 80% of cases are going to be mild. When I was in school, an 80% was a really good passing grade. And if you have a 94% chance that out of this illness, whether you have even a serious infection or a mild one, you have a 94% chance you will not need a ventilator. The last time I checked, that was an A in school. And I used to gamble quite a bit. And if I went to a casino that had an 80 to 94% chance that I was going to be fine, I would take those odds. I'd play at that casino. The rates of getting super sick are super low. What we need is people to quarantine themselves. If you are sick, if you have these symptoms, you need to stay home. We are currently doing a partial lockdown to try to prevent the spread of this quickly because it spreads fast. But there's still a good chance that you will need to do nothing if you're the 80% that have mild disease. The 14% that will need to go into the hospital, you will be okay. As I sit here and do the math, I don't know that any of that equals 100%. So I don't know where the percentages are. Ask the World Health Organization. But 80% of you can stay home. 14% will wind up in the ICU. And 4% will be the super sick ones on the ventilator. So the question is, I'm worried about what if I die? What if I am that 14% with severe symptoms or the 4% on a ventilator? As I said before, you're in the greatest nation for treating sick people, with the smartest minds, the most talented of physicians taking care of you in the ICU and doing what's best. And we're learning from doctors across the world how to make this not so scary. It is true that some people will not survive this. But if we have the resources and you stay in the ICU, and even if you need a ventilator, you're in the right place. You're in the right hands. We are equipped to handle sick people like this in this country. We do need to flatten the curve, so stay home. No play dates, no visiting, no extra trips outside the home. I need sick people to gradually have to go to the hospital and need those ventilators and the ICU care. I don't need them all there on March 22nd. So please wash your hands. Use this time of anxiety, worry, fear to do something good. Call someone, take care of someone, smile, hug your little ones, and enjoy. It's a rough time. These emotions are not bad, and you will be okay. Until next time, this is Dr. Scherer. Wash your hands a lot.